Welcome and thank you for joining our webinar hosted by Cenegenics Carolinas Live on Sex Drive, How to Earn a Gold Medal in the Bedroom. On the line we have Dr. Mickey Barber, Age Management Specialist and Chief Executive Officer of Cenegenics Carolinas, as well as Tiffany Jackson, Cenegenics Carolinas Nutrition Specialist. Please stay tuned to ask your questions of Dr. Mickey Barber and Tiffany Jackson after their presentation.
Well, good evening, everyone. This is Tiffany. Welcome to our August webinar, Increasing Sex Drive, How to Earn a Gold Medal in the Bedroom. With the new bestseller, 50 Shades of Grey, the erotic novel has been getting our patients to talk more openly about sex, sexuality, desire, and interest. So we thought we would do a webinar on it, and we've actually had a really good response. So we're excited that you guys are joining us. Healthy sex requires a multitude of components, from brain neurotransmitters to hormone and nutritional imbalance. It has a strong connection to our vascular system as well as psychological health, which we're going to just try to discuss all this evening. Sexual function can be prevented and treated, making it possible to maintain a satisfying sexual life well into advanced age. So virtually everyone can maintain a healthy sex drive, and that's what you're going to learn about tonight. We have Dr. Barber on this evening to teach us how. So welcome, Dr. Barber.
Thank you, Tiffany, and welcome to everyone who's on the call. And let me just qualify up front that it's storming like crazy here, so if you hear thunder in the background, you just ignore that. But thank you so much, everyone, for being on the call. Wow, we are so excited. We have had an overwhelming response to this topic, so that's pretty exciting. And I find that really, really exciting because really one of the main reasons I went into age management medicine was really to help patients restore their sexual function. I mean, I had learned in medical school and then kind of learned through society that we expect our sexual function and our interest to decline with aging. And particularly after the age of 40, I found that that was kind of nonsensical to me, and just I was not willing to accept that. And the more and more that I've learned about the aging process and about age management medicine, I know that we can really help almost everyone have better sex, whether that person is 35 and in peak physical condition, 40 and starting to experience some signs of declining health, 55 with a heart condition, or 70 with multiple health issues. So there's really, in my opinion, no better way to gauge your health and to feel and look 15 years younger than to start enjoying long-lasting sex as frequently as you'd like. And, you know, I just feel like sexuality is something that we as physicians have completely overlooked and undertreated. And really, sexual activity ideally should never fall to less than once weekly if that's what you want. And we're here to help you with this. So one question I want you to think about is, why are you on this webinar and what made you want to call in? We've had a lot of questions already sent to us, which we're going to handle at the end of the call, as well as opening up to questions for those of you on the call. But I want you to think about this. We are really here at Cenegenics Carolinas the experts in maintaining sexual energy through the aging process. And I hope that you understand that by the end of this webinar and understand why a comprehensive approach is key. During this webinar, we're going to discuss a lot of topics. We won't cover everything in detail. We might talk about some things that might make you a little bit uncomfortable. I hope not, but you're on the call, so let's get started.
All right. Thank you, Dr. Barber. We also do have a guest patient on, so we may end up going just a little bit over, but we're hoping to keep it right at 30 minutes. So let's get started, and why don't you just give us an overview of the physiology of sexual function?
Yes, and there should be a slide there in front of you, and I kind of like to simplify this for my own self and to explain it to my patients. I mean, sexual function in men and women is a very complex system, and it really starts with the brain and the nervous system. So obviously there has to be some sexual attraction to the person that you're interested in having sex with, so that the drive actually starts in the brain. And then that signal has to be transmitted all the way down the spinal column into the nerves around the genitalia and around the reproductive organs, so that the whole sexual response can start. So very, very important. So things that can affect that are everything from stress, your own feeling of self-esteem, your mood, your emotion. Diabetes can affect nerve supply to the genitalia, both in men and women. We sometimes think only men, but women as well. Also, if you've had some major spinal injury or spinal surgery, nerve damage, all of those things can affect sexual function. The next component is the blood supply to the genitalia, both in men and women, so that vascular supply. Very important. That's one reason why that very popular drug like Viagra and Cialis works, is by affecting blood flow to the genitalia in the penis. So we know that cardiovascular disease can affect sex drive and performance, and that medications that affect the vasculature, that is high blood pressure medication or certain heart medicines, can also affect sex drive in men and women. So that is the next component. And then the final component is really the hormonal component, which a lot of times is really ignored. And it's very important because it's an intricate balance between several hormones. I like to think of it as sort of the sexual symphony of hormones, that all of them have to be in tune for it to make beautiful music together. So it's very important to understand that all of these systems have to be working, and that's our job, to give a comprehensive overview and then a comprehensive program to approach all of them.
Great. Well, why don't you go over the factors that cause people to have a decreased sex drive?
From the hormonal balance side, let me talk about that a little bit. That would be the next slide.
Okay.
And there are lots of different hormones and disorders that can cause that. I mean, hormonal imbalance happens in men and women. In men, it's called andropause. In women, it can present in perimenopause, pregnancy, postpartum or post-pregnancy, and menopause as well. And all of those things can start to affect sexual function. Thyroid balance is also very important and can cause low sex drive and can affect sexual performance. Autoimmune disorders, things like lupus, fibromyalgia, rheumatoid arthritis, chronic pain, all of those things. Anxiety, worrying about things or worrying about your sexual performance, it can become a big monster.
So, Dr. Barber, your cell phone service, or phone service, seems to be cutting in and out. Can you hear us okay?
I can hear you great. Let me relocate. It is storming like crazy here. Hold on. Can you hear me now?
Yep, that's fine. If you just want to start back at the autoimmune disorders, that would be great.
Sure, sure. My apologies. It's really stormy here. Anxiety and depression. Anxiety can lower sex drive. If you're worrying about your sexual performance, that can certainly affect your physical ability to achieve arousal and perform, and it just becomes kind of a vicious cycle. Painful intercourse with women in particular, this is called dyspareunia. That can come, particularly we see a lot of women after menopause coming in with issues with vaginal dryness, which can result in painful intercourse, and no one wants to have sex if it hurts. Alcohol, moderate amounts can be good for you. Too much alcohol can really interfere with sexual function. And smoking cigarettes is a big one. Nicotine and tobacco is a very potent vasoconstrictor, and it narrows the blood vessels that supply particularly the penis. And that narrowing of the blood vessels can last up to 6 hours after a cigarette. So if you smoke and you want to improve your sex drive, it's a really big motivation to quit.
All right, great. Well, since we specialize in hormone optimization, why don't you go ahead and touch on the intricate balance of hormones and if there's any special ones that the listeners need to be getting evaluated when they're concerned with decreased sexual function.
Sure. There is a pretty detailed slide up there that outlines some of the hormones. And keep in mind, these are only a few of them. There are many more, and I see one that I'm going to mention that's not even, I don't think, listed on there. But let me back up a little bit. Cholesterol is really the backbone of hormones. So if you're taking a medication to lower your cholesterol and your cholesterol is extremely low, I know you might feel good about that, but it's probably affecting your sexual function because it's affecting your hormone level. So just keep that in mind. Estrogen is very important for vaginal lubrication, for achieving orgasm. Progesterone in women is important for mood and libido, as is pregnenolone. Testosterone, we know, can help both men and women within just a few weeks of starting it to improve their overall sexual performance, libido, energy, self-esteem. So very important. DHEA is the one I get really excited about that I even underappreciated. I have one patient who's in his 70s who has been on several different hormone replacements with me for quite a while and was starting to see some decline recently in sexual performance. We upped his DHEA. He had not been taking it, and that particular problem improved significantly. I want to mention the thyroid because it's extremely important and many times overlooked as its contribution to sexual function. And again, I think it's a very important part of the whole sexual symphony of hormones.
Great. Well, what would you tell someone that's just seeing their primary care physician for sexual function and they wanted to have their hormones tested?
Wow, that's a hard question for me, Tiffany, because I really feel like if you have to tell your doctor what test to run, then you probably need a different doctor. I think that most doctors are not well versed in sexual function and sexual performance in men and women and don't kind of get the whole big picture, and I just wouldn't recommend that.
All right. Well, I think this is a good time to bring on our special guest. So, Ms. Hay, if you are there, you can go ahead and unmute yourself. Let's see. Are you there?
Yes, I'm here.
Hi,
Wonderful.
Mrs. Hay. How are you?
Hello.
Hi.
I'm fine.
I hope you can hear me over the thunder and lightning and rainstorm and wind that's out there. But tell me, the people on the call, a little bit about how you're feeling now and what you were experiencing as far as your sex drive when you first, or before, I guess, you joined our program.
Okay, well, to start, I'm 53 years old, and I had already been going through menopause for several years and had went to my doctor to seek, the traditional hormone replacement treatment that they would put you on, and none of it worked. I just absolutely had no sex drive, none whatsoever, and when I would have to, I felt like I had to for my husband, it was very painful, and I just did not want to engage in that.
So it was not really
but I had none. No, it wasn't, and I had no desire, none whatsoever.
Yeah. So I'm sure that, I mean, your husband is a patient of mine as well, and I'm sure that it had an impact on your relationship.
It did. It did.
And
you
so
feel
how
the strain.
fast? Yeah, sure. Once you started on the program, I mean, did you see results quickly, or did it take a few months, or what did you see?
Well, within 2 weeks, it was wonderful. It only took about 2 weeks, so.
Wow. I almost hate for you to say that, because everyone's going to think that. That's really remarkable. And, I think in your case, too, I mean, you started feeling better, right?
I started feeling better. I was more energetic. I had just a complete overhaul on my brain. I had a more positive attitude about everything, and I don't know. I just couldn't tell you how much it changed my life and his as well.
Yeah, so your husband's kind of excited about that change?
Oh, he's very excited, very satisfied. We went from 0 to twice a day most of the time.
Yeah. That's pretty good stuff. Well, listen, I can't thank you enough for coming on here and sharing your story. You know, we always appreciate that, and particularly from a woman who's a little bit shy, I think. So thank you so much.
You're
Yeah,
welcome.
and great,
Thank
Miss
you.
Hay, it's Tiffany. I know we were talking earlier, and your husband was going to join us, but he wasn't able to this evening. But you asked him a question for me, and I wanted you to ask him, you know, what was his experience with his sex drive after joining our program, and he's going to let you answer for him if that's right.
He did. He wanted me to say that he had always had a strong sex drive. It became a little stronger, but what we had noticed was the longevity. It went from a good 30, 45 minutes of normal to 2 hours every time. And I'm not even kidding.
And how old is your husband? How old is your husband?
50. He's 50, and I am 53. Mm-hmm.
All right, so sex doesn't stop at 40. Awesome.
We proved that myth. Thank you, Mrs. Hay.
You're welcome.
All right, Dr. Barber. Well, just jumping back in, a lot of our program does, you know, revolve around exercise and physical fitness. So what can you tell us about that?
Yeah, you know, I think as medical practitioners, we've overlooked the impact of being physically fit on sexual fitness. I mean, if you don't feel good about yourself, if you lack muscle strength, you're just not going to have as good of a sex life or even be as interested as you could be. So part of our job is to get people in better shape. And obviously it's good for your heart, it's good for your blood pressure, it's good for your body fat, et cetera, but it's also better for sex. Exercise increases blood flow everywhere in the body, including to the genitals. There are studies that show that women have better orgasms within the first hour after exercise. Sex is also an act of endurance, so by improving your cardiovascular fitness with aerobic activity like walking, running, cycling, swimming, things like that, you can really help both partners perform longer and more often. I think push-ups, sit-ups, core exercises, anything like that that's really going to strengthen your core, your belly, your abdomen, really important. Having enough upper body strength, shoulder strength, chest, abdominals, all of those can be utilized, obviously, during sexual intercourse. So really important to keep these muscles strong to increase your strength and stamina, which will add to prolonged, more pleasurable sex. The other thing that I found is that the pelvic floor muscles in men and women gets weaker as we age. And so like any other muscle, you need to think about strengthening those muscles. It's a very important thing to do. There are lots of ways to do this. I'm just going to mention a couple of them, but there have been several studies that have shown that just 6 weeks of certain kinds of pelvic floor exercises, you might know them as Kegels, in men have been shown to improve erectile dysfunction. 6 weeks. So that's an exercise that's worth doing if you're having that issue. And the reason it's so effective is that it increases blood flow to the area. It also tends to tighten those muscles so they can contract during orgasm and during erection. So really important. A couple ways that you can do this. One is kind of when you're just riding in your car, you can think about tightening up the area around your anus like you're having a bowel movement, and hold it for 10 or 15 seconds, relax, tighten it up again, relax, tighten it up again, relax, like a real exercise. Another way to do this is for men and women to improve orgasm and sexual function, is when you're urinating is to start and stop the stream of your urine as often as you can do it, maybe 2 or 3 times during a urinary stream. And in women, you can really see a benefit with orgasm and sexual function within a few weeks. So when you're urinating, you need to stop and start the urine flow. So kind of an easy thing to do, and something that can really make a big difference. And you want to do that kind of exercise 10, 20 times a day. So again, really important to get that pelvic floor that tends to loosen, like the rest of us as we age, if we don't pay attention to it. And that is going to help with your erectile function, with orgasm, and with generalized sexual pleasure. So I think of it like anything else. If you don't use it, you'll lose it. So, really important. And remember, it's never too late to start an exercise program, and it's never too late to start having sex. Many older people that have been celibate for years develop satisfying sexual relationships after they reach their 50s or 60s.
All right. Well, that was a good overview and good exercises. Can you tell us what can our listeners do to heighten their sex drive?
Yeah, good question. And this also is a slide up there. This might be too much information for some people, but, this comes up a lot. And, we do a lot of work with couples as well as, people that come in solo. And, we forget sometimes that it may take a little bit more for us to get, sexually stimulated. The older we get, we have a lot of stress on us and, things on our mind. And so you really have to focus on that mind as an erogenous zone. I think one of the reasons 50 Shades of Grey is selling so well is it's a fantasy that people are reading, and men and women, and enjoying. Whether you agree with it or not, people are reading it. So think about setting the mood, a nice dinner with candlelight, soft music, whatever for you would turn you on is important. Remember that, changes in physical appearance don't mean an end to sexual pleasure. So if there's something about the way that you look, you've been with your partner a few years and you don't feel like you look the same as you did, you have to talk about it. And it may be that you even need, some counseling to help you to deal with that. If you've got a lot of arthritis or joint pain, you may have to try some different positions. We put some other positions up here on this slide. You may want to think about putting, cushions or a pillow under your hip for both the man or the woman, to help so that, you don't get sore or have joint pain as part of the sexual experience. For women, you may need to use a vaginal lubricant like Astroglide or KY jelly to help with the vaginal dryness. We really focus on that with Cenegenics to try and turn that around, and I think we're successful by 99% of the time. Watch that alcohol. A little alcohol might be just enough to get you disinhibited, but too much alcohol in men and women generally decreases sexual performance. I think another big thing that people don't realize is you got to find a compatible time. I mean, if you're a morning person and your mate is an evening person, maybe 50-50, half the time you do it at night, half the time in the morning. If the only time you're relaxed enough is on Sunday morning, great, set aside a time for that. But really focus on finding a compatible time. One of the positions that for those of us over 50 has been shown in the literature to be a good position is kind of what we call the spooning position on the side. It doesn't put a lot of pressure on your joints, and that's something else to think about. One thing for men that has been shown to help with erectile function is something called a penile ring, that it's actually slipped on the base of the penis once the penis is erect to help keep it erect for longer. So again, try and make it more comfortable, play around a little bit. Hopefully you're at a point in your life where you trust your partner, and this may be a very good time to try some new positions and to bring some new things into the relationship. And always remember to keep a sense of humor, because not everything's going to work. Tiffany, why don't you tell us about some foods that can affect sex and how we feel about it?
All right. Well, improving your sex drive might be as simple as just taking a trip to the grocery store, because there are several foods that are reported to help improve sexual desire and giving you a higher sex drive. And one of the big ones that most of you have probably heard about are raw oysters. They've had a big reputation of raising sexual desires in men and women when eaten raw. They're a natural aphrodisiac. They contain high levels of zinc, which raise testosterone levels, and they do increase libido naturally. Nuts are another big one. Most varieties of nuts are rich in L-arginine, which there's been big hypes about that. It's been shown to improve sexual function, especially in men, and what it does is it improves circulation to the body, which leads to more energy to help with sexual issues, especially increasing circulation with erectile dysfunction. Common nuts, the almonds, peanuts, cashews, and walnuts, those are some of the most common ones that can help achieve a higher sex drive. And chocolate, that's another famous aphrodisiac, especially for women. It contains theobromine. It's similar to caffeine, and it also contains another chemical called phenylethylamine, which just makes men and women feel enamored. So dark chocolate is the one that you want to get. It contains the antioxidants and helps with circulation as well. And then garlic, believe it or not, there is a lot of info out there about garlic, and it may not seem like it's a likely choice for raising your sex drive, but especially when you think about the bad breath reputation that it has. But it contains an ingredient called allicin, which is known to increase blood flow, especially to the sexual organs. So just adding it to a lot of recipes, you know, that is one other area that you can support, you know, adding some more healthy foods, which me being the nutritionist here, that's something I like to talk to patients about. So I think we are getting close to running out of time here, but Dr. Barber, I really want you to go over the relationship between diabetes, erectile dysfunction, and heart disease, especially for our men out there, because this is something that could really save their life. So why don't you go over that
definitely.
really quick?
Yep, absolutely. You know, so important and has been overlooked for years. Almost 70% of diabetics have some degree of erectile dysfunction. So it's a huge issue with diabetics, and many of them just accept that that's the way it has to be. It is not. That erectile dysfunction can be a result of low testosterone, both in diabetics and pre-diabetics, but also is an indicator in many cases of underlying coronary artery disease. So very important. If we don't see that improve, you know, it's a big red flag for coronary artery disease. This is because there's a narrowing of the penile artery from deposition of cholesterol and other inflammatory substances. Same as what goes on in the heart. As part of our evaluation, along with fitness and hormones and all the others, we look at the carotid artery and the intimal thinnest layer, which is an indicator of coronary artery disease, along with some much more advanced testing to be able to see how heart healthy you are. So early diagnosis and the correct comprehensive approach to your sexual life can really represent an important step in cardiovascular evaluation, which will absolutely contribute to better choice of treatment for hypertension and preventing some of the complications and restoring the quality of life that we think is so important. And, you know, we want you guys to stay on the call. So, Tiffany, what's coming next? We've got the questions, I know, already.
Yeah, we do have some questions. So I think we should just go ahead and jump right into them. I don't want people to hang up because this is a really important part of the call. We do have a lot of questions from our audience. So stay with us for another 5 or 10 minutes because I do have some important info to share with you. So let's see here. Let me go ahead and just start with the first question. All right. Do varicose veins on my testicles affect blood flow to the penis?
They should not. No. That is a venous supply. The varicose veins are veins, so it should not be affecting the arterial supply to the penis.
Okay. My penis is lifeless, and my wife says that she cannot feel me when I am inside her. Is this natural once you hit 50?
Absolutely not. That is a red flag as far as I'm concerned for, number one, looking at if you're on any medications, finding out what they are. and seeing if they're having an effect, seeing if there's some systemic disorder, diabetes, coronary artery disease, hypertension, that's affecting the penis and its erectile quality, and certainly the hormonal component. So absolutely not. That is not natural once you hit 50.
Okay, what if you have had your prostate removed?
Yeah, good question. And actually, Tiffany, I think there are two questions that we received earlier that kind of are on the same. You want to read that second one, men's prostate surgery?
Oh, yeah. Okay, so I had men's prostate surgery with nerve-saving techniques. Is there any help for these surgery failures? Cancer is gone, but so is libido, drive, just ED. Is there any hope at all?
Right. So those are both kind of about the same thing. Men that have had prostate cancer and have had a prostatectomy. And it used to be that there was really no hope. You know, whether it's a nerve-sparing procedure or not, many men still have erectile dysfunction after surgery. There are, if the nerves are damaged, it's a different treatment than if it's from the hormonal aspect. But we see good results. We treat men who have had prostate cancer on an individual basis. So that is a very good person to call us and discuss.
All right. How does hypothyroidism affect libido and performance?
Well, kind of the same thing that I talked about earlier. It's just a very important hormone that affects that whole hormonal cascade, along with your energy level, your cardiac function, your vasculature. So hypothyroid can be very important for libido. I do see another question was about growth hormone and controversial hormone supplements. Growth hormone is one that I did not have on that chart. I wanted to mention that in some people, growth hormone does help with sexual function, and we do use it when medically indicated. We do extensive testing to verify that you're medically deficient in growth hormone. So less than 15% of our patients are on it, but when you need it, it can be very important.
Okay, I have lost my sex drive due to blood pressure medication. How can I regain it?
Well, first of all, we have to dig in a little bit deeper, you know, find out if there's a way we can turn your blood pressure around without medication. We wouldn't do that immediately, but there are lots of different blood pressure medications, and they do not all affect libido. We also want to make sure that there is no coronary artery disease or no vascular disease. And, of course, the hormonal component is hugely important. So lots of things to do there. We do sometimes use daily Cialis in people that have a vascular issue with their sexual performance. So there are lots of options there. Has anyone else got questions, Tiffany, that has been on the call? I'd like to give them an opportunity.
Yes, we do. One of them is I have recently been having discomfort and pain in the rear entry position. What could be some causes?
Well, first of all, I don't know if that's a male or female, and
it
that
is
would
a
help.
female.
That's a female.
It is a female.
And that's kind of a hard question for me to answer without a conversation, but there are a couple of things that I would think of. One is if the uterus is engorged in any way, fibroid tumors, anything like that, that was certainly affected. Certainly any GI issues, constipation, full bladder, anything like that can affect that position. And if you're not well lubricated. So those are all potential reasons. I think that would require kind of a personal conversation, which we'd be happy to have. Other questions?
Yeah,
Tiffany?
that would be. Yep, there are. This is from a male. I am not premature. I am just the opposite. My partner says I take forever to achieve orgasm. Can this be caused by antidepressants?
Yes, it can. It can, and we do see that because the stimulation is not enough, so you have to think about changing positions, changing the kind of stimulation. I do find sometimes testosterone helps with that issue, but that certainly can be part of antidepressants.
All right, and here's another question. It says, you mentioned L-arginine for blood flow. Are there any other natural supplements that are good for sexual function? I could actually answer this one. There are. First, I recommend before people just start, playing supplement roulette, they get a full evaluation and make sure there aren't any hormonal imbalances, especially with the hormones. And then if you wanted to help increase some sexual energy, there are some herbs. The Asian ginseng is a big one that can increase sexual function. There's also an herb called kava that's helped for relaxation, and it's used as an aphrodisiac, especially in women. That's a popular one. There is a Chinese herb called horny goatweed. That one is pretty popular to improve sexual function, and then also zinc and maca root in women. So those are a few just to throw out there. Let's see. Somebody said they lost their internet when we were answering questions about libido lost after prostate surgery. Can we repeat that?
Yes, I'll be happy to repeat that.
Okay.
Yeah. Can you hear me okay?
Yeah, I can hear you fine.
Okay. It's very important, and I really recommend that you call us. I mean, I would say that we are one of the few practices that actually, I think, does a good job of treating men after they've had prostate surgery. And it's a complicated issue because it can be vascular, hormonal, or nerve. But certainly the hormonal component is a big part of the issue. And that's not just for sex drive, but that's important for body composition, to prevent osteoporosis, for cognition, and lots of things. So absolutely that can be approached, but again, that's kind of a one-on-one conversation. So, and we're going to have someone available to talk to you this evening. So any other questions, Tiffany, before we tell them how to do that?
Yeah, no, that's actually it. So are there any last closing comments you'd like to make?
No, I just, I'm just thrilled that people are talking about this, and I recommend that you continue to talk about it and to realize how important it is for your relationships, not just with your spouse or your partner, but with yourself, for you to feel better and more excited about your life. This is a good time in life, and it's time for us to enjoy it. So, Tiffany, you want to give them the information?
Yeah, absolutely. So the important info I wanted to share is that we actually have some people right now here in the office ready to speak with you and to get you scheduled to get your blood work done. Because if you get started right now, if you think about it, by the holidays, your sexual function could be dramatically improved. So we are available here in the office. We'll be sticking around this evening. The number is right here on the screen. It's 843-724-7272. So call us right now to get scheduled for your executive health evaluation. And
Tiffany,
I
can you repeat that phone number one more time, please? One more time.
Yep, it is 843-724-7272. It is also
Great.
on the screen. And if you have any other questions, feel free to also, call us tomorrow, or you can email mbarber@cenegenics-carolinas.com. But we do live in a world of, fast food approaches for everything. But when it comes to your sexual health, don't rely on quick fixes. If your arteries become occluded, there can be a lot more than erections at stake. And our program here at Cenegenics Carolinas addresses all the health issues essential for patients for stress reduction, hormone balancing, glucose management, weight loss. Patients come to us for better sex, but they really leave on their way to better health. So we hope that you can take that away from this webinar. And we also have a webinar next month. It is going to be everything you need to know about vitamins and supplements. It's Wednesday, September the 19th at 8 p.m. So we hope you will join us for that as well. So I'm going to turn it over to Brittany for the closing remarks. Thank you, everybody, for joining us this evening. And call us here at the office this evening. Again, 843-724-7272.
Thank you, Tiffany. And just as Tiffany said, we do have team members here available for you to answer questions or provide you with more information. So please feel free to contact us directly. Again, the number is 843-724-7272, or you can email Dr. Barber at mbarber@Cenegenics-Carolinas.com. Feel free to register on our website. We can get more information to you that way as well. The website address is